Good morning, good afternoon, good evening, everyone. At this official Tokyo Nutrition for Growth side event on accountability. On behalf of the Global Nutrition Report, the Access to Nutrition Initiative and Results UK, I would like to welcome you at this session on action on accountability, lessons learned and the way forward beyond the Nutrition for Growth Summit. I am Inge Kouwer. I'm the Executive Director of the Access to Nutrition Initiative, and I'm your moderator today. Before kicking off the official program, I would like to mention to you that if you have any questions to our speakers or any suggestions or comments, please use the Q&A. And also you can see in the chat function relevant links to important documents and other information. This webinar will be recorded, so we will distribute it to all of you after this side event. I would like now to share with you some opening remarks from Dr. Amy Inaoka. She is the Deputy Director of Global Health Issues at the Ministry of Foreign Affairs in Japan. And as the co-host or at the host of the summit, we thought it would be good to share her opening remarks with you today.
Distinguished guests and colleagues, I wish to express my gratitude to Global Nutrition Report, Access to Nutrition Initiative, and Results UK for their contribution to the success of the Tokyo N4G Summit and give me the opportunity to join you today for this post-summit event. At the summit, we issued the outcome document of the Tokyo Compact on Global Nutrition for Growth, which summarized the direction for the international community to proceed in order to improve nutrition from now on. This compact was endorsed by more than 200 stakeholders. Thanks to all those who participated in the summit, not only the governments, but also a wide range of stakeholders, such as international organizations, private business, civil society, and academia. Strong and smart commitments were announced towards concrete actions. About 180 stakeholders, including 66 countries, submitted more than 319 commitments, which includes over $27 billion financial commitments. The summit brought stakeholders across broad constituencies together, and the efforts made by all to tackle nutrition issues were truly inspiring. We must commend the efforts of each and every single one of those stakeholders for stepping up for nutrition. This year's N4G Summit focused on improving nutrition outcomes through integrating nutrition services into health systems to universal health coverage, food system transformation, and greater resilience in fragile and conflict-affected contexts. Although it sheds a light on the critical need for greater financing, stronger data systems, and the need for strengthened accountability to make real progress in the fight against malnutrition in all forms. The emphasis on the roles of accountability really sets Tokyo N4G Summit apart from the previous summits. Quality data collection and evidence-based progress measurements and reporting are key to ensure nutritional improvement outcomes. A system for collecting data will be established or strengthened while paying attention to cost effectiveness. Today's event would be meaningful as we could promote coordination among all stakeholders on ensuring transparency and accountability to maximize the result of Tokyo N4G Summit towards ending malnutrition. During the summit, we are delighted to hear that France will host the next N4G Summit in 2024. At the next summit, it is a sincere hope that we will see progress of the commitments delivered last week under the improved accountability, which will lead to new commitments to combat malnutrition in the final 5 years of the SDGs. Ensuring accountability is everyone's business and responsibility. Although we continue to face challenges such as COVID-19 pandemic, we know that ending malnutrition is achievable and must be a priority for the global community if we are to ensure no one is left behind on the path to a healthy, sustainable, and prosperous future. Thank you very much.
Thank you, Emmy, and thank you to the government of Japan for these opening remarks and also for the important leadership on the summit, and especially with the focus on accountability. I would like now to introduce to you Dr. Shibani Ghosh, independent expert group core member of the Global Nutrition Report, and she will cover an overview of the commitments made at the summit and also on the nutrition accountability framework. Over to you, Shibani. Shibani, I can't hear you.
I was still on mute. I thought I'd unmuted. So thanks, Inga, for pointing that out and for the introduction. And also thanks everyone for joining us today. It is my privilege to be speaking on behalf of the GNR Independent Expert Group at this event. This post-summit event really provides us an opportunity to reflect on all the momentum that has been gained around the summit. This year's summit was truly critical for nutrition, and it was inspiring to see so many stakeholders across different constituencies step up and make very strong and smart commitments towards nutrition. In addition to reflecting to the summit, this event will provide us an opportunity to begin discussing the way forward for nutrition accountability. The year of action and summit are only the beginning of this journey towards strengthening nutrition accountability. In today's presentation, I will provide a short overview of the commitments that were made in the N4G Summit and touch briefly on the way forward. I'd like to emphasize on behalf of the GNR that this is a process and that we will continue to need the valuable support of our stakeholders as we step into 2022. Now, before I share the overview of commitments, I want to highlight a key point that was made by Renata Misha, who is the chair of the GNR IEG during the summit. As she noted, we face an ongoing nutrition crisis and within particularly the context of the COVID pandemic, and we are critically affected by poor accountability measures, especially when we are trying to assess the momentum towards global targets as those set by the SDG. So strengthening accountability has been highlighted as a critical issue, as already been pointed out by Dr. Inaoka. And we really need to focus on the context of commitments and ensuring that we can assess and track commitments and ensure transparency. Now, as you all may be aware, the GNR has been tracking commitments made in the previous summit since its inception in 2014. And a critical finding of the IEG in this process of tracking is that these past commitments were not necessarily qualified as SMART. That is, they were not specific, measurable, achievable, realistic, or time-bound. And utilizing smart approaches is one way that we can push forth in terms of strengthening accountability and ensuring transparency. So there's been a call, and also there's been a call for better and coordinated accountability by different stakeholder groups. And so in 2019, as part of the preparation of the summit, as you all are all aware, there were 5 thematic working groups. And what's very critical to note here is one of those thematic areas is accountability. Furthermore, the government of Japan made accountability as a key requirement for the summit. So there's definitely momentum and there's interest, and I'm really excited to see this this coordination across the different stakeholders to move forward on this topic. One of the key one of the key things that the GNR has done has developed the first independent and comprehensive nutrition accountability framework, and it's called the NAF. That's what we call it as a short form. So what is the NAF? The NAF is a framework that aims to drive stronger nutrition action and accelerate progress. The aim is to translate commitments into action and impact. The framework is designed to record all new commitments on nutrition, monitor their impacts, and set out requirements for commitment formulation. The NAF is redesigning or redefining how nutrition-related commitments should be formulated, registered, and qualified. It has allowed us to create a common system, a language, and develop principles to unify tracking of nutrition action. And this is also critical in moving forward in tracking and ensuring accountability. Now, at this year's N4G Summit, we saw an incredible number of strong and smart commitments registered to the NAF, through the NAF. And I will now give you a brief overview of these commitments. On this slide, we summarize a few of the achievements. I should like to note that this is still a process that's ongoing, but you'll find a lot of this information in the compact annex when it is finalized and available. I believe that this is in due process and should be available on the N4G website as well as the GNR website. So what are the achievements? First of all, just under 400 new commitments have been made by 181 stakeholders across 78 countries. And what I'd like to note is that most of these were made by country governments. We also have a sizable set of commitments made by civil society organizations as well as private sector businesses. When you look at the thematic areas, you find that health and food are 2 top commitment areas, followed by resilience, financing, and data. What does that translate to? Now, when you look at the actual financial commitments that have been made, about, as Dr. Inaoka has mentioned, it's $27 billion have been made, have been announced and or registered. Of this, about 23 billion are already registered in the NAF, and the GNR team is following up on the rest of the announcements that have been made. 60% of these are by donor governments and about 40% are from donor organizations. So what are the trends here? First of all, huge impactful commitments by country governments. Donor governments have made specific financial commitments for nutrition-related assistance to over $15 billion. Furthermore, as I noted, there's a huge influx of commitments from country governments. 80 government departments and ministries from 66 countries, mostly low and middle income countries, have made over 200 commitments in this summit. International organizations have created an enabling environment to improve nutrition. 10 international organizations, which include both UN organizations as well as the Sun Movement, have made 21 commitments that focus on creating an enabling environment. And one critical point is, again, substantial resources, financial resources have been allocated to nutrition by donor organizations and not just by donor governments. That amounts to about $8 billion towards nutrition-specific and nutrition-sensitive interventions. There has been a strengthened presence of the private sector. And what I'd like to note here, that in addition to private sector food businesses, we also have private sector non-food businesses that have made commitments. As always, civil society organizations are making a difference. There's a strong presence of CSOs with 51 civil society organizations making 86 commitments. And finally, academia is present in the fight against poor diets and malnutrition. 7 organizations, 7 institutions, including professional associations, have made commitments to conduct scientific research to advance the nutritional status and diets of populations. Of course, this is only the initial picture of commitments. The stakeholders have stepped up and used the NAF to register both bold and smart commitments. We are in the process of conducting analysis to get a much better picture or a fuller picture of the commitments being made, but I'd like you to join me in celebrating such an amazing mobilization. Now, before I go into the way forward, let me just show you a little bit about the global the nutrition accountability framework. This visual sort of outlines the process that the GNR has to undertake to ensure that the commitments that are being made have been reviewed and then are tracked and then are reported on. So it's a process. And as you can see, that what we've done is the first step of the process. That is, we've developed the commitments and we've got registered commitments. GNR is reviewing these as we are speaking. And then once these are all finalized, they will be published. Now, a key point here to make is that when the review happens, it is an extensive interaction with the stakeholders who have made those commitments. That is very, very critical for the success of finalizing these commitments and publishing them. And as you can see at the bottom of the slide, you have all these different actions that still need to happen. In addition to reporting on action, we will annually review these actions and publish on them and then sort of push the community to take more action. So what's the way forward? Next slide, please, Charlotte. So in terms of the way forward, what is the IEG and the GNR focusing on? We are focusing on processing the commitments, as we've mentioned above, and we want to fine tune them and strengthen them. As I've already mentioned, this requires extensive engagement and interaction with stakeholders, and the refining of commitments will continue, something that will enable us to track and report over time. Once this is accomplished, we will take stock of the year of action and publish the final commitments. As we move into 2022, we will work on the reporting element of the framework, which is the bottom half of that framework that I just showed you, and ensure that we encourage more action for the future. Now, the key thing is that moving forward, we need to approach, and this is how GNR views this, we need to approach nutrition accountability in a holistic fashion, and we need to focus on consolidating and leveraging existing mechanisms for accountability. To achieve this, what we would like to do, the GNR would like to convene a technical advisory working group that will provide strategic advice on monitoring and measurement of accountability through the NAF. The working group is likely to comprise of technical experts, policy specialists, folks who represent nutrition accountability and monitoring mechanisms and initiatives that operate at a global scale. Of course, this is all is in process. The remit of this working group needs to be fully defined, but we envisioning leveraging and engaging existing mechanisms for different constituencies and recommendations. This is just a starting time. This is just a start for an exciting time for nutrition. And I'm looking forward to hearing all the speakers today, get the takeaways from the thematic sessions and get reflections from them from how existing mechanisms could strengthen accountability and support action for better nutrition for all. Thank you very much. And I appreciate getting the little extra time.
Thank you, Shibani, for this good overview of the commitments. And as you mentioned, I think we can all be very proud and good also to hear the first thoughts on how are we going forward and how are we ensuring that the commitment makers are held to account. So thank you for sharing that with us. We're moving now to the first panel session, and I would like to introduce to you the representatives of the 4 thematic working groups. So we have on the panel for you today Ajay Tandon, lead economist of the World Bank Group on behalf of the Finance Working Group. Second, we have Nancy Aburto, Deputy Director, Food and Nutrition Division at FAO, who is representing the Diets Working Group. We also have Connell Foley, Director of Strategy, Advocacy and Learning at Concern Worldwide, who is representing the Resilience Working Group. And last but not least, we have Dr. Francesco Branca, Director of the Department of Nutrition for Health and Development at the World Health Organization, who is representing the Working Group on Universal Health Coverage. Welcome to all of you, and I would first like to give the floor to Ajay to share his reflections on the summit with us.
Thanks very much, Inge. Just wanted to mention that I work quite closely with Meera Shekhar, who is our global nutrition lead at the World Bank, and I think she was the co-chair of the N4G financing working group. And happy to be here. Nutrition is one of the most important development investments, not just because of its impact on health and other outcomes, but also because of its economic returns and cost savings that we can have as a result for the economy, for productivity, for education outcomes. And we also believe firmly that building proper accountability mechanisms and capacities are key to maximizing the investment impacts. I think everybody agrees that the Tokyo N4G Summit was a big success. Specifically from the financing perspective, we could say that the biggest achievement was that several countries, as was already noted, explicitly committed domestic financing for nutrition at the high level, which shows a very strong political will to invest in nutrition in coming years. Indonesia, Rwanda, Somalia, Gambia, Mali. And this is a big leap from previous summits. Also, some countries have highlighted their commitments to also doing more financial analytics and strengthening the use of data systems for accountability. All this means is that now nutrition is firmly embedded within the dialogue around public financing, together with other sectors. Through the process of this formulation and registering the commitments, we also observed good discussions happening in several countries involving both health and other line ministries or financing or planning ministries, nailing down really what they can commit and to be held accountable for. I just wanted to add that the fact does remain that many countries don't even know how much they're currently spending on nutrition across relevant sectors, meaning in many cases we are flying blind, at least with regard to the public financing angle, how much nutrition financing there is. And there is a growing recognition that this is critically needed, that we need to uncover what financing is, and as the adage goes, what gets measured gets managed. So if we don't even know how much financing there is, how can we manage that? But several countries have now done public financing assessments and what we in the World Bank call public expenditure reviews for nutrition, including several that I was myself involved in South Asia, in Bhutan, in Nepal, in Sri Lanka. The studies that we did were not only important in coming up with sort of the number as to how much there was financing, but also recognizing that there are other challenges related to fund flows and in terms of improving the efficiency of existing outlays. And these studies, like other growing nutrition public expenditure reviews in other parts of the world, have commonly identified the limitations of available data across relevant sectors and at the subnational level, and the need to develop standardized systems of data collection and assigning accountability, so that these reviews are not done as one-off activities, but can be made much more routine and conducted regularly, and that budgetary tagging of nutrition interventions can be part of the process of doing the budgeting. So I'll just end by saying that this Tokyo Summit and the Nutrition Accountability Framework have brought us to the starting line for making nutrition financing and accountability a driver for actions and impacts. Particularly important in this time of COVID, when not only has COVID been a health shock, it's been a massive economic shock. And many countries are under macro fiscal stress, which will not go away. Even if COVID goes away, it's going to last for several more years. And really, I've talked mostly about what has been happening at the country level. So one final remark would be that the partners also need to align our efforts and investments behind country priorities, be it through traditional external financing allocations or through new catalytic investments where private financing is being leveraged. And it's time to measure and put this accountability at the forefront of how we develop systems and capacities. I'll end here and hand it over to Nancy. Thank you so much.
Thank you, Ajay. Let me just start by saying that from my perspective, the Tokyo Nutrition for Growth Summit 2021 was really an indisputable success. And so I join Dr. Shabani in congratulating the government of Japan and really celebrating the accomplishment. I think we all should. And the scale of the financial commitment that we saw surpassing that of 2013 summit is truly needed today in a world where we're facing unprecedented and unprecedentedly complicated challenges. Of course, it's a world where we're facing climate change and biodiversity loss and of course the pandemic, and these are all testing our collective ability to make progress towards global goals of Agenda 2030. But it's really not just the financial commitments. It was inspiring and invigorating, really, to see the great number of stakeholders, especially the number of countries that were making their commitments, and to see the commitments across all of these thematic areas, the health, the diet, the resilience. And I feel that this is a real testament to the collaborative effort of elevating nutrition in a multi-sectorial and holistic way. Now, from a food systems and healthy diet perspective, that was the technical working group that I helped to co-chair. The Nutrition for Growth Summit really provided us an opportunity to solidify commitments to action to address the drivers of malnutrition across agriculture and food systems that otherwise might have just languished in aspirational words in other events that occurred throughout the year. And what I mean by that is the Nutrition for Growth provided a platform for harnessing the momentum that was coming out of other very important global events, the COP26, the Biodiversity COP15, and of course the UN Food Systems Summit. And this allowed food system stakeholders to move to the next step in catalyzing transformation of food systems for healthy diets through this pledging process. The UN Secretary General said something that stuck with me. He said that the UN Food Systems Summit profoundly affirmed that our food systems hold the power to realize a shared vision for a better world. And it also established some clear and ambitious goals for food systems that reflects that complexity between environmental, economic, and social pillars of sustainable development. But the Tokyo Nutrition for Growth Summit really allowed the space for stakeholders to pass that enthusiasm and that multi-sectorial spirit to pledge that nutrition would be an indispensable part of the solution. So this, of course, is not the end of the journey now that we've completed the summit. And as Dr. Shabani said, it's now time for us to realize those commitments and fulfill those pledges. And an ownership of programs and the ability to hold actors to account are really crucial to ensure that activities will actually get implemented. And the diversity of the commitments, what we're celebrating, those financial, policy, programmatic, and impact commitments, also pose a challenge for that monitoring and measuring in a consistent way as we move forward. However, this nutrition accountability framework, the NAF, that was launched in advance of the summit, is really already making an important contribution in this regard. And I'd like just to reflect a minute on my organization, the FAO. As the United Nations Specialized Agency for Food and Agriculture, we of course have expertise across all of agriculture and food systems. And with that, we have a mandate to raise levels of nutrition. And our organizational-wide strategic framework puts as a top priority the ambition of better nutrition. Therefore, of course, FAO is committed to the areas of food and the area of resilience in the context of the Nutrition for Growth. And we want to effectively support members to achieve their targets. But the GNR and the NAF really challenged us to shape these priorities and ambitions into those SMART commitments, which required us to collectively reflect on what it means materially for the organization in terms of prioritization of the array of resources that we can bring to the table. And in the end, FAO has 4 SMART commitments through which we'll make meaningful progress on policy and program at global and national level, helping to support that enabling environment. And importantly, we know the world's watching, so we will not fail. We will follow up with those commitments and complete them. So it's really the GNR and the NAF, by the essence of being, that have made an important contribution so far in the realization of the commitments through supporting that important process that allowed a pledging and a laying the groundwork for meaningful accountability. So let me just conclude by reminding us that strengthened governance and accountability for nutrition is actually one of the action areas of the UN Decade of Action on Nutrition. And this area is based on a number of recommendations that came out of the Framework for Action from the 2014 ICN2, that's the International Conference on Nutrition. And this means that countries that participated really helped to formulate those recommendations and highlighted the need for accountability to bring our ambition in nutrition to fruition. And the Global Nutrition Report and the NAF are really a great testament to this. And we at FAO were really so pleased with the outcomes of the Nutrition for Growth. And more than ever, we are really looking forward to collaborating with partners to catalyze implementation and to work together to reach our goals of zero hunger and, of course, healthy diets for all. So with that, I thank you, and I will pass the microphone over to Connell. Connell, over to you.
Thanks a lot, Nancy, and hello, everybody. Again, I'd just like to reiterate what AJ and Nancy have said about how inspiring Nutrition for Growth was. And I think a key part of that really was the role of GNR and the creation of the SMART level of commitments. But just in terms of what I want to talk to you about as well, so just give you a very quick takeaway on the Nutrition for Growth from a resilience point of view. And then I want to talk a little bit about accountability at 4 different levels. So while I was on the resilience thematic working group, I don't purport to speak for them. I speak on behalf of Concern Worldwide, my own organization, and as I suppose co-chair of SUN as well. But I think it was fantastic to see commitments from more fragile countries, and I think that's a great change, probably from previous times. It was positive to see so many commitments tagged under the resilience theme. I think it was about 42% of total commitments. Obviously, they were behind the commitments for health and food, albeit there are probably large overlaps involved, but probably a reflection of sectoral thinking still existing to some extent. However, it's all about action, of course, and there was very little reference, for example, to longer-term commitments by donors in more fragile contexts, bridging the humanitarian development nexus, flexibility in funding and stuff like that. Surprisingly little reference to shocks, climate change, risk reduction, DRR commitments, those types of things, with some notable exceptions. And as the concept of resilience hasn't come through strongly from the private sector commitments either. But I think the Tokyo Summit has made great strides in giving visibility to the unique nutrition challenges in fragile and conflict-affected contexts. But it's all about action and accountability. So I'd just like to talk about maybe 4 different levels of accountability and what I would see as maybe some key accountability mechanisms for 3 of them at least, and alert you to the 4th. So again, when I talk about these kind of fragile and conflict-affected contexts, I'm assuming that it's sort of you've got government systems alongside the humanitarian coordination system, because that's really what happens in most of these countries. So if I get to level 1, the immediate needs around community level delivery in particularly in emergency contexts, I mean, it's all about the humanitarian delivery mechanisms and architecture and actors here. And, embedded within that, as within longer term interventions, you've got a lot of good participatory methods. You've got accountability involving communities. And I think it's critical that communities are involved in holding the people who are meant to be delivering services to them to account. So, involving them in targeting criteria for safety nets, for example, for community refugee or IDPs, management groups, giving people agency and voice in terms of the quality and quantity of services they're getting. So again, participatory M&E, focus group discussions, service user satisfaction surveys, etc., etc. And really, things like citizen accountability mechanisms, social audits of clinics, community scorecards, those types of mechanisms. And then this idea of complaints response mechanisms, which are embedded in what's called the core humanitarian standard. I mean, one of the problems with these kinds of very effective local accountability mechanisms is they work well, but they're quite bitty and unevenly applied by NGOs. And I think this is where things like the core humanitarian standard certification is an attempt to remedy, trying to get NGOs up to a common standard and applying them in similar ways. The second level really, I think, is the one that most people talk about, which is country responsibility for delivery of these commitments. And I think, again, it's a combination of, you know, government responsibility and accountability to deliver on the national nutrition plans, things like the wasting action roadmaps, via, you know, things like the multi-stakeholder platforms in some countries, etc., etc. But I think it's very much looking at the appropriate division of labour between the clusters and technical working groups. It is about a multi-sector approach to nutrition being embedded in inter-cluster coordination mechanisms. But it's all about also the clusters and multi-stakeholder platforms working together. And I think they do tend to now be involved in each other's systems. I suppose the whole triple nexus, the humanitarian development peace nexus, points to getting this coherence around joint analysis and agreed or joint outcomes, so that accountability for humanitarian actions, development and peace building interventions is shared and agreed. Now, humanitarians are obviously always worried about leaking of funds for humanitarian action into prevention and peace building work, but it's clear that the intent of the nexus is that we need to prevent as well as treat. I think core to all of this probably is neutral, impartial data, joint monitoring, and I think the Global Network Against Food Crisis has really got the idea about trying to get agreement in relation to this. On a more practical level, I think, I think one of the things that we need to do here really is build on the joint action, the joint annual assessments that are part of the whole SUN process, the joint annual assessment of how the nutrition action plans are going and the application of all actors around those. I think getting input and voices from communities and subnational level into the joint reviews really brings those alive. I think we need to change and shift the nature of the joint annual assessments so that challenge is possible and also welcomed. And challenge being welcomed actually requires a culture change that I think will need a lot of work from all of us. The third level, I think, is the one that's been referred to, and I think it's fantastic that the Nutrition Accountability Framework, I think, is extremely helpful. It's very action focused, and I think we all need to get behind it, and because it is focused on smart commitments, unlike the Food System Summit. I think in addition to that, SUN has now produced this multi-stakeholder accountability framework, so that it allows us to address issues of accountability to SUN principles, for each network to each other, for governments, for the SUN support structure to governments, for example, and vice versa. But it also allows us to address the issues of accountability to SUN principles and the ongoing vexed questions of the BMS code violations, for example. What's interesting is maybe from a resilience point of view, what may be missing is accountability of some major key donors to commit to necessary flexible funding, adaptive management mechanisms, etc. And I think one of the questions in the chat was around were the humanitarian needs and the humanitarian appeals part of the Nutrition for Growth Summit, and I don't think they were. So I think it's about actually looking at those together.
Thank you for your reflections. We need to wrap up, so can you
okay, my final point then, just I'll skip the fourth level, which was really around conflict and the fact that we have a real problem with not being able to address conflict, which is a key driver of malnutrition. But I suppose my final key points are coordination requirements are critical. We need to use existing accountability mechanisms that work. And it's all about building service delivery capacity. It's a long, slow road, but critical. And I think workload impacts on delivery, which impacts on accountability. So apologies for going over, and let me hand over to Francesco.
Thank you very much, Conal, and good morning. Our assessment of Nutrition for Growth has been an incredible and really so rewarding success. And we haven't seen this for many years. In nutrition and health, we have seen so many new commitments to increase the coverage of nutrition interventions in health. Around breastfeeding, around the code of marketing, breast milk substitute, many actions on stunting, focus on vitamin and mineral supplementations, and with a very large number of countries. I mean, you heard already 67% of the commitment were done on nutrition and health in the health sector. We have seen 23 countries making this important commitment. And our assessment is that this is changing a bit the paradigm used so far. We have seen much more happening in terms of defining all forms of malnutrition, in covering areas which were neglected, such as maternal nutrition. So all this is extremely encouraging. How could we achieve that? I mean, that was due to basically a lot of mobilization. I really would like to reflect on it. The preparation of that and the mobilization around that was critical. Even the quality of the commitment was much higher than before, as already said, because there was a clear definition on what a commitment should look like. I mean, all the work that we have been collectively doing around commitment guides followed, but then the preparation of the outreach group. And I really would like to acknowledge the work done by the Sun movement to really get those commitments. Of course, we could do more. So if we look at somehow the expectations and see what has been done, the scale of the commitment probably is still not sufficient to turn the tide. The comprehensiveness. I mean, there are some areas which are still missing, but a lot is happening. What is, of course, challenging now is the implementation of it. A few countries made some important commitments around the financing and the human resources, but we definitely believe that in terms of commitments have been focusing mainly on trying to achieve the reduction of anemia, stunting, but haven't necessarily worked out the resource requirement for that. So we anticipate some challenges in the implementation, and so that's why. From the UN point of view, and certainly from the WHO point of view, we have said, okay, let's be ready. Let's hear this commitment, and let's try to be ready to provide support and, as Shibani put it, an enabling environment for this to happen. So WHO has made a commitment on around 7 areas, among them infant and young child feeding, anemia, obesity, food environment, the data. So I think we should be there to hear the commitments that countries have made, and yes, of course, accountability, being able to make sure that they're implemented, but also support that implementation so that we can all collectively say we have achieved it. So basically, my key message around accountability is that this is not about pointing fingers to others. It's about a collective accountability. How can we collectively make sure that this incredible package of commitment is implemented? And I'm sure we can do that. Thank you.
Thank you, Francesco, and also thank you, Connell, Nancy, and Ajay for your rich insight and reflections on the summit. That is really very inspiring. And I would like to ask to spotlight the work of Alejandro Gil, our visual illustrator, who has made a summary so far of all those commitments and thoughts on the way forward. And if you see this, you see the richness. So you also see that we are running a little bit over time. We will try to shorten the next part, but it is very good to hear all those inspiring comments on the summit and the way forward. Thank you. I would like now to introduce to you our panelists for the second panel, which is more on existing accountabilities and how can we use those existing accountability mechanisms in monitoring the progress on the commitments made at the Nutrition for Growth Summit. So I would like to introduce to you Sean Conhan, who is the Advocacy and Youth Advisor at the Scaling Up Nutrition Civil Society Network, Marije Boomsma, Program Director at the Access to Nutrition Initiative, and Kaya Engelsveen, Technical Officer at the World Health Organization, to give their short reflections on existing accountability mechanisms. Sean, first, over to you.
Thank you very much. And I'm aware that time is a bit tight, so I'm going to do a bit of a whistle-stop tour through some interesting examples that I'd like to share around civil society leading accountability. So just going to share my screen. So can everyone see a map now?
Yes.
Brilliant. So I was going to show 3 or 4, but perhaps we don't have time. But I'm going to I'll share the link to this map so you can look through it all in more detail later. But here are just some interesting examples of where civil society have led on accountability processes. So I'm just going to zoom into El Salvador. So this is a really nice example of where the Sun Civil Society Alliance, Alianza Nutres, really kind of got in there early by engaging with government decision makers and building those really strong relationships with through those multi-stakeholder platforms ahead of those key moments like the UNFSS and the N4G, and worked really closely with the First Lady to kind of empower her as a nutrition champion. As a result of this really sort of positive, constructive accountability, we saw really strong commitments from El Salvador towards breastfeeding and food security, aligned with their national commitment as well. So the key learning there really, and actually which applies to all of these examples, is that accountability doesn't have to be a negative thing. Often we think of accountability as kind of punishing people who, or decision makers who renege on their responsibilities. But what we see from civil society is actually making those early interventions to actually see accountability as a positive, collaborative, constructive thing. And that's reflected through all of these examples. So I'm just going to whiz into Burkina Faso. Again, this is a really positive example of collaboration. So already the government of Burkina Faso was leading the way here in making really strong interventions to support pregnant women, ensure that their children had access to good nutrition. But civil society saw that it could add value here by applying sort of a monitoring and evaluating framework to this. And so, you know, appreciating the good work the government was doing, but offering to kind of constructively hold them to account and monitor the progress and share reflections and advice about how this program can be strengthened. So again, it's maintaining a really positive, constructive relationship and celebrating the good work the government was doing. And as a result, we saw, you know, we've seen that this program already was doing well, but it's continued and strengthened. And I think a testament to the success of this was that, you know, the security situation in Burkina Faso could have easily meant that this program fell by the wayside. But thanks to the partnership of civil society, this program has endured, and we've seen improved nutrition outcomes for under 5s in Burkina Faso. So let's just zoom out and just zoom into Tanzania. I hope I'm doing okay for time. I've just got 1 or 2 examples to share.
If you can share Tanzania, and there are a lot of enthusiasm in the chat, so I definitely would advise you to share indeed the map with the audience later. Thank you.
Definitely. Okay, I'll just wrap up on this Tanzania one. So this is from PANITA, which is our Sun Civil Society Alliance in Tanzania. And again, another really positive example of reaching out to stakeholders who already hold a lot of power, so parliamentarians, and looking at how they can hold their peers and their colleagues to account and encourage them to go further and live up to the responsibilities and the commitments that they have around nutrition. So they started a program, sort of like a parliamentary champions program, which has now seen the size grow to 50 members of parliament. The Civil Society Alliance now has these really active champions who are speaking out in support of nutrition and holding the government and their colleagues to account when it looks like they're falling short on those responsibilities. And I won't go into detail on the last one, but it's a really great example in Indonesia of grassroots communities, empowering grassroots community to hold decision makers to account, informing them of their rights, and empowering them to speak out. It's a really great example. So I'll share the link to the map so you can go through them all in detail. Just to conclude, one last point I wanted to make is that the Civil Society Network is going to be launching our Year of Accountability next year. So this is following on from our successful year of action in the run-up to the Nutrition for Growth Summit. And we've just got 2 key objectives that we want to achieve. So it's ensuring that the Nutrition Accountability Framework is used and that effective practices are put in place to hold commitment makers to account, and also to equip civil society with measurable guidelines to hold commitment makers to account. We're really excited to be launching this accountability charter and a campaign to kind of to launch it and implement it. And we really invite anyone who's interested to get involved. So feel free to reach out to me. I'll share my contact details. And if you'd like to also, if you have interesting examples or case studies of civil society-led accountability, we are looking to really grow the size of this map. This is just the start, and we want to create this as a really useful resource that we can share with partners and other stakeholders, so we can learn more from how civil society are leading the way on accountability. Hopefully I've stuck to time there. I'm going to hand straight over to Maria Boomsma.
Thank you very much. So my name is Marije Boomsma. I'm a program director with ATNI, Access to Nutrition Initiative. I have a few slides. I will try to keep it really brief. I wanted to share with you some lessons learned that ATNI got over time since its establishment in 2013 in keeping companies accountable for their investments in making healthy food affordable and accessible. So if we can go to the next slide, please. ATNI has developed various accountability tools over time, of which the flagship is the Global Access to Nutrition Index that assesses the 25 largest food and beverage manufacturers globally. But increasingly, we are also have developed new tools also in country, like the US Spotlight Index, the India Spotlight Index, and we are currently preparing for the first UK Retail Index that will be published in March. And in the next slide, I have summarized some of our key lessons. Accountability is, well, the direct engagement with companies that is really has been key to, I think, our success in getting companies on board in the global indexes and really help them in, well, of course, collecting data, but also then sharing best practices and priority areas of action through our index accountability work. Not only does the Access to Nutrition Index provides information and lessons to the key users, the companies, but also to other stakeholders. Such as investors, the investor signatories of ATNI is an important group, but also other stakeholders, researchers, policymakers that can influence company behavior. And one of the key successes for our accountability work has been that it helps in demand alignment and standardization of different practices. And that is mainly because the index methodologies are linked to international accepted targets, such as the WHO nutrition targets and the SDGs. Three key challenges that I want to share with you, which are also important for the NAF, is, well, the SMART commitments. We've heard it several times today. We need to be really smart in order to compare also organizations, particularly when we look at the private sector in our indexes, and we need to have a baseline to measure results from. The second one is that, well, our assessments really rely on transparency and publication of materials reporting, and that is needed in order to really see our progress. And thirdly, which is an important one, particularly when we look at business accountability, that we are dealing with global standards and commitments on the one hand, but they sometimes conflict with national legislation and performances in countries. So therefore, the alignment between standards and guidelines is very important, and not only for the organizations that are kept accountable, but also specifically the accountability organizations. For instance, ATNI is also an ally of the World Benchmarking Alliance, and we really try to align and also build upon each other's work there. So final statement that I wanted to make, that accountability is not only about sharing data, but also about engagement and dialogue among stakeholders. And that, I think, is very important also between the summits to continue doing. Thank you very much.
Then over to you, Kaya, for your comments on behalf of World Health Organization.
Thank you very much, Inge. And thank you also very much for discussing accountability here today. It is one of the principles of a human rights-based approach, along with participation, transparency, non-discrimination and equality, empowerment and legality. And one important step towards ensuring accountability is to measure progress on commitments made and expose those monitoring results. In WHO, we started monitoring of nutrition policies in countries after the 1992 International Conference on Nutrition. And in 2012, the global database on the implementation of nutrition action, or GINA, was launched to make all this data publicly available. And GINA, as we know it today, contains about 10,000 data on policies, legislation, standards, programs and actions, coordination mechanisms, and decade of action nutrition commitments in countries. It's an impartial and independent monitoring mechanism focusing on all countries and all forms of malnutrition. And the data in GINA, they come from WHO surveys and regular monitoring work, from partners and from a wiki approach where anybody can register and contribute to the database. In WHO, we analyze the policy data and use this to create reports, maps, or country scorecards, and to assess progress in different nutrition areas, such as sodium reduction. And key indicators are also reported to the World Health Assembly, to the United Nations General Assembly, and to other bodies. And I would just like to make 3 brief points to keep the momentum going for accountability and to build synergies between all these different initiatives. First of all, it's important to build new commitments made at N4G and other fora into existing reporting systems, such as GINA and the Global Nutrition Report, the World Health Assembly, and others, as well as yearly reports of the residence coordinators and country-level mechanisms. And all these different systems, they should mutually reinforce each other to increase the visibility rather than creating any competition. And this way we can really have a louder voice and create visibility and good progress, and also to highlight the gaps that we know exist in countries. Secondly, we also need to collaborate and share not only the data, but also the methods of analysis and collection processes. Importantly, we should reduce the reporting burden on countries and to avoid to ask for the same information multiple times. In the last WHO Global Nutrition Policy Review, for example, we pre-filled all our questionnaires with information that was available to us, not only from WHO, but also from our partners. And continued monitoring of the progress is also essential in time and along the policy cycle and impact pathway. Because adoption of a policy is not a done deal, box ticked. We need to assess how it aligns with normative guidance and the scope of it, whether the country has set up mechanisms for monitoring and compliance, and if the actual implementation is met, such as the coverage of service delivered, and how it impacts the food environment, diet, or health. Lastly, we also need to think about how our monitoring work can engage right holders to hold the duty bearers accountable. And what was mentioned earlier, through involving them through local accountability mechanisms. One striking difference of this year's important summits, I think, are the voices that we have heard from young people, with different youth groups and advocates raising their voices, telling their governments that they will be watching. So to conclude, we really look forward to contribute to the nutrition accountability framework with data, analysis, and to mutually reinforce each other. Thank you very much, and back to you, Inge.
Thank you, Kaya, and also Sean and Mariah for your insights on the existing accountability mechanisms. And it is good to hear that there is already so much there in place, and it is indeed about aligning those mechanisms and bringing it together. And with that, I would like to give the floor to Dr. Shabina Ghosh again from the Global Nutrition Report to wrap up the session, because the Global Nutrition Report will take the lead in the way forward. So thank you all panelists for your great insights. Over to Shibani.
Thank you so much, Inga, and thank you everyone for joining. It's been inspiring to listen to everybody and listen about the different initiatives and thoughts around how accountability can be assessed and measured. And what really I'm leaving with is there are many different definitions of accountability. So we're going to have to do a lot of thinking and assessment and analysis and interactions across all those different stakeholder groups as we move forward in the implementation of the NAF. On behalf of the GNR, ATNI, and Results UK, I'd like to wish everybody a very happy holiday and a very, very happy new year. Thank you all.
you.